Hello, my name is Estrada, and I'm going to be talking about the concept of abstinence and celibacy as a form of contraception. Abstinence and celibacy is something most people would immediately cast away just for the idea of it, because it's something that they believe they cannot actually do. But there are very good advantages when somebody actually does practice it in the correct way. To begin with, I'll identify the difference between abstinence and celibacy because there are differences in them. Abstinence is the practice of doing only certain sexual behaviors that eliminate pregnancy and STD chances, like oral, vaginal, anal intercourse. They don't act on any of these. Abstinent people only practice outer course, which is include kissing and mutual masturbation with each other. While celibacy, on the other hand, is the complete avoidance of any sexual and physical interactions with somebody else. The use figures for abstinence are the following, are presented in the following chart, which is from Gutman.org. The chart represents contraceptive effectiveness rates for pregnancy prevention, and the highest one in the chart is abstinence, which is 100% perfect in use when it is used in the right way, which is like consistently. You have to keep a mindset of actually doing it all the time and not giving into your sexual desires. And then the following just fall into female sterilization, oral contraceptives, male condoms, and then withdrawal as the following best uses. But the highest one would have to be abstinence. The cost of abstinence is free. There is no charge in it. It's just the idea that you have to be able to actually keep up with doing it and not giving it at any time with your sexual needs. Because if you do, then you do fall into the chances of actually getting pregnant or having any STDs or any STIs. It's just your mindset pretty much. Advantages and the positive side effects of abstinence would have to be that a couple doesn't have to go through any pregnancy scares. You don't have to always keep thinking if you did or didn't use any of the methods right, or having to like worry about any of these things. You also it prevents any STIs from being transmitted or spreading whatsoever, because you're not having any penile or vaginal contact with anybody else. Also, for women, it has no medical or hormonal side effects, like it could happen with the pill or any other birth control methods. You don't have any mood swings. You don't have to go through any irregular menstrual cycles that can affect like your daily life. Another thing is that when people practice abstinence, they only do practice the outer course, which could be a positive thing because you can just um, interact with your couple in a more meaningful way, because you don't have to be worrying about the chances of getting pregnant or being transmitted or anything. So you're more focused on the other person rather than having to worry about any future challenges or possibilities of any of these negative side effects from actually happening. When it comes to the protection of STIs, abstinence is the best form of contraception. It's 100% effective with no failure rate unless a person or a couple just gives into their sexual desires, that's clearly stated. It helps in preventing the many diseases like herpes, HIV, hepatitis A, chlamydia, and many other diseases that are risk when people do interact in sexual, anal, vaginal, or penile intercourse. Abstinence is the easiest form of contraception that can be obtained because there is no need of any prescription in having to go anywhere to acquire it. It is just a decision a person has to commit to, and it will be the best conception method available, unlike other contraception methods like the pill or diaphragms or anything like that do have a chance of failing at any point. This abstinence is the one that has the best outcome and is the easiest way to obtain as well. Thank you.